Hello, my name is Rajiv Agarwal. I'm a pediatrician and the head of the tongue tie program at Agave Pediatrics. Welcome to Agave Pediatrics tongue tie program. As you know, Ankyloglossia or tongue tie associated with lip ties is probably the most common cause of failure of breastfeeding. At Agave Pediatrics, we just don't offer a tongue tie procedure. We offer a complete program. We follow your progress from the time of diagnosis to the time we have been able to achieve the best possible breastfeeding relationship for you and your baby. It takes a village to raise a child, and so it takes a village for a family to be able to breastfeed. Team approach within our office with our nurse practitioner, with myself doing the procedure, with our tongue tie coordinator, and also with our associates in the community, including lactation consultants and body workers like chiropractors, craniosacral therapists, is a very important part of the tongue tie program that we offer at Agave Pediatrics. Through this video, I would like to take your hand and walk you through the procedure, the whole process of tongue tie evaluation, diagnosis, and treatment at Agave Pediatrics. Your first visit is probably going to be with the nurse practitioner who has had a lot of experience in helping families with breastfeeding and diagnosis and evaluation of tongue tie. We give you a lot of information, we give you some videos to look at, and also try to help you in accessing resources in the community which will help you in this whole process. Your second appointment is going to be with me, where I will go over the history all over again with you and answer your questions. I will also discuss with you the possible risks of the procedure. We will go over the post-procedure exercises, pain control, and all the other things you've been worried about with you in detail. During that procedure, the tongue tie coordinator will also come and talk to you to discuss your other further concerns. After your procedure, we are available to you through Facebook, through telephone calls, through emails to answer any questions that you have. Your third appointment is for a follow-up. During this appointment, we like to evaluate how are you doing? How is the baby doing? Were there any complications? How much pain was the baby in? How have the 2 weeks or 10 days, depending on when you were coming back, have they been for you? So that there is an improvement in your breastfeeding relationship. At that time, we also evaluate if there are still symptoms that we need to evaluate you for an upper lip tie. At that point, if we believe that there is still an improvement which is to be desired, we will offer you another appointment for an upper lip tie procedure.
Hi, my name is Stephanie. I'm one of the nurse practitioners here at Agave Pediatrics, and I'm going to be discussing exactly what ankyloglossia is and some of the difficulties that children with ankyloglossia may experience. So what exactly is ankyloglossia? Also commonly known as a tongue tie, is a condition in which the band of soft tissue under the tongue, which is called the lingual frenulum, is unusually tight or thick or short and tethers the base of the tongue to the floor of the mouth. For most people, this band of soft tissue retreats or separates, so to speak, prior to birth and doesn't cause any issues. But some children are born with this tight band and it does cause difficulties. A tongue tie can limit movement, lateral movement, which is the side-to-side movement of the tongue, as well as upward movement, which prohibits the tongue from touching the top of the mouth or the front of the upper gums, in addition to forward protrusion, which inhibits the tongue from sticking out past the lower gums. While some infants born with a tongue tie may not experience any problems, others face pretty significant difficulties, especially with breastfeeding. So let's discuss why tongue movement is so important. The tongue serves several functions which all require adequate range of motion to be carried out properly. In infancy, the tongue must be able to extend out beyond the lower gum line and up so that the infant can latch onto the breast and breastfeeding can be successful. As children age, restricted tongue movement becomes more apparent as difficulties arise with swallowing, enunciation of certain words while speaking, and even the ability to stick the tongue out and lick an ice cream cone or play certain musical instruments. How may a tongue tie affect a toddler? So let's talk beyond infancy. What happens when a toddler has a tongue tie that's problematic and isn't corrected? Some tongue ties go untreated until toddlerhood when other difficulties such as chewing or speaking arise, aside from breastfeeding. One such difficulty may be the articulation of certain sounds when they're speaking. Some of these kids speak with a lisp, and they'll have difficulties with L, R, rolling of the R, N, TH sounds, SH sounds, and even Z sounds. Consequently, delayed speech milestones are not uncommon in this population. Dental or oral issues are also prevalent in toddlers with problematic tongue ties. A progressive gap may develop between the front lower teeth, and because food is not easily swept away from pockets in the mouth or at the gum line, early cavities and gum disease can also exist. So at Agave Pediatrics, we've had really great success in limiting some of the problems associated with tongue tie. We've even seen significant improvement in things like jaw pain, snoring, sleep apnea, and migraine headaches. So you might be asking yourself, why was my child born with a tongue tie? And the answer to that is we really don't know why one child is born with a tongue tie and another isn't. We do know that tongue ties tend to run in families and that they have some kind of genetic component to them. We also know that they're twice as common in males and that up to 10% of newborns are born with a tongue tie with varying levels of dysfunction. At Agave Pediatrics, we really promote breastfeeding as providing optimal support to infants. And because of that, we receive referrals for tongue ties from all over the valley and even all over the state. We specialize in the diagnosis and the treatment of tongue tie, and because of that, we see a much higher rate of tongue tie in the infant population than the reported national average. We're now briefly going to discuss lip ties so that in the event one is identified during your consultation, you'll have some familiarity with it. An upper lip tie occurs when the band of connective tissue that tethers the gum to the upper lip is unusually tight or short or thick. A lip tie can prevent the lip from flanging out, which may impair the child's ability to form a tight seal around the nipple of a bottle or the nipple of a breast. In toddlers, when the teeth start to develop, food gets stuck between the upper lip and the upper gum and may increase their chances of developing cavities. Upper lip ties are commonly associated with tongue ties in addition to other midline defects, such as a high or a dome-shaped roof of the mouth, as well as a recessed jaw.
Hi, I'm Penny Lee, and I'm one of the nurse practitioners at Agave Pediatrics and part of the tongue tie team. I'm going to talk to you a little bit about how we typically diagnose tongue tie. Let's talk about anatomy. The anatomy is how the baby's tongue is developed in utero and how it is able to be used to express the milk. The function of the tongue is how the baby uses the tongue to express the milk from the mother's breast. When we look at function, we are looking at the elevation of the baby's tongue, the ability for them to lift the tongue up to the roof of the mouth, the lateralization of the tongue, the ability for them to move the tongue from left to right. We also look at the extension of the tongue, the ability for the baby to stick the tongue out and extend it past the gum line. If any one of these is present, if the baby is unable to elevate the tongue well, lateralize the tongue well, or extend the tongue, we know that this is a clue that a tongue tie may be present, or if mom and baby are having breastfeeding issues. With tongue tie, both mom and baby can present with different symptoms. Some maternal symptoms include nipple pain, sometimes distortion of the nipple, sometimes there can be scabbing or even bleeding. Other symptoms we may see include extended feedings, plugged ducts, and in worst case, mastitis. Moms may experience thrush and low milk supply, and all of these symptoms may be due to baby not being able to express the milk from the breast. Signs and symptoms that baby may experience at the breast include poor feeding, poor latch, poor weight gain, and frustration. Moms may report that baby is not satisfied at the breast, fussy, and that feedings may extend longer than periods of 20 minutes. Mothers may also report that baby is making clicking or slurping noises while at the breast. Babies may experience excessive air intake or dripping milk out of the mouth during breastfeeding or bottle feeding. Babies may also experience gagging or choking during feedings. Due to excessive air intake, babies may have reflux or be considered a colicky baby. During your consultation, I'm going to look in your baby's mouth, and I will ask you a host of questions of how breastfeeding is going. If your child is older, we may ask you questions about speech and feeding difficulties that your child is experiencing. All of this information indicates to us that a tongue tie may be present and a revision may be necessary.
Hello, my name is Valerie. I'm the tongue tie coordinator for Agave Pediatrics. The day of the procedure, you may be feeling overwhelmed with all of the information that has been given to you. My job is to make sure that you feel comfortable and know what to expect over the next few weeks to come. While Dr. Agarwal is performing the procedure, I will come in and we'll go over a specific aftercare plan for your child. I know this is a lot of information given to you, so we will be in close contact over the next few weeks. If your child has a procedure done, we recommend that you do a follow-up about 2 to 3 weeks after the procedure. In the meantime, if you're struggling with exercises, pain management, or any other issues, I'm available for triage. I'm here to guide and support you through this whole process. It is important that we have a plan to manage any discomfort that your child may be having. Some parents have a preference on what they feel comfortable administering to their child, so the day of the procedure I will come in and we will develop a plan that is not only safe for your child, but will keep your child as comfortable as possible for the next few weeks. It is very important that you start the playful exercises as soon as possible. Building a trust with your child and getting them comfortable with fingers in their mouth is very important. Also, I feel that it will give you the confidence that you need to perform these exercises properly. We've provided you with some YouTube videos on how to properly perform the exercises. Also, at any time if you feel that you are doing them incorrectly, please give me a call. As I said before, I'm here to guide you through this whole process. Working with an IBCLC after the procedure is very important. So huge, in fact, that I've noticed a big difference between the babies who have worked with somebody and the ones who have not. The moms who have not worked with the lactation consultant are definitely still trying to figure things out at the 2-week. So I highly recommend that you follow all of our recommendations and work with a lactation consultant 3 to 5 days after the procedure. So you should have received an email with a link to our Facebook support group. On this Facebook support group, you will find other mothers who have gone through this procedure. They can definitely be there for support, give you any tips or tricks on how to get through these rough couple of days. We also have some great lactation consultants there, along with myself and Dr. Agarwal, who could answer any medical questions if we need to. If you have not received this email with all of the information that I have discussed, please check with our front desk and make sure that we have your accurate email information, and I will resend it again. A provider will be in with you shortly to start the consultation.